All right, thank you everybody for being here in the Getting the Most Out of ETO track. I wanted to introduce who will be talking today, the stars of the show from Family Services. And then after introductions, I'll open and have Mark talk about the great things that they've done with Family Services and how it relates to the track today. So first thing is, I'm Vince Griffith. I'm one of the co-founders of Social Solutions, strategic consultant, which is largely in the role of implementing ETO software, and in the best cases, as we're talking about today, working with organizations to actually transform into performance-driven organizations. I want to introduce the main speaker today, Mark Lieberman, who's the Executive Director of Family Services of Montgomery County. You'll hear more about them. And also Shushma Patel, who is one of the ETO administrators and runs actually a new program there, but she has run several of their programs as a program manager in addition. Before Mark begins, the main thing I want to talk about today is that when you're in the track of getting the most out of ETO, the assumption is likely that there will be a lot of ETO, right? So we're going to be looking at how is it configured, how do you use it, lots of ETO screenshots and detail, and what really will be shown today is that in order to get the most out of ETO, the organization has to prepare itself to be performance-driven, and so it's not a trick. It's not as you're in here and you're not seeing a lot of ETO. You ultimately will see certainly how ETO relates to this and how ultimately they've gotten much more out of ETO. But the thing that I think as a company we've discovered over 11 years doing the work, and that I've personally certainly discovered, is that as much as what was talked about yesterday is essential and must happen, it's why we went into business, that change must occur to better serve people in your communities. It's very challenging from an organizational change management perspective to actually do that. And there are certain key components that we'll hear about today: leadership, commitment, resources, and a doggedness that is true of the work that you all do with people on a day-to-day basis, and has to also become true of the way that you run your organizations in a performance-driven manner. So I'll say one last thing and then I'm going to hand it off, and that's that I am so excited to be here today to have Family Services tell their story, because it's one of the best things that I've been able to do in the 11 years I've been doing the work. It is a great story. It is possible. It's being done. And today you're going to hear about that, and you're also going to walk away with what I consider some of the best resources that will be handed out at the conference. So you got a lot of information there. As I've told Mark, it's gold. It is, when people ask, how do you actually do this? You have in front of you how it's actually being done. So with that, I'm going to hand it off to Mark and have him take you on the journey of their getting more out of ETO while transforming their organization. So, Mark?
Thanks, Vince. And what Vince didn't tell you was how lucky we were to have Vince as our implementation manager. I think we are blessed to have Vince, who has an amazing ability to be able to translate the 20 programs that we have in the agency into the software, and to understand, when we tell him what we're doing, how to interpret that into the software as part of the blueprint and the build-out of the software. So I included in the handout for the PowerPoint, in the next slide, I include my contact information if anybody wants to talk with me later. And I want to tell you what the handouts are that everybody should have at their place. First, there's obviously the PowerPoint presentation. And secondly, I have the ETO, or I guess it's called the ETOlution Milestones document that was prepared by Odile Swift and Karen Walker, which I'm going to talk about. And you'll see there was some influence in the charts that you have in front of you, which kind of outlines our theory of change journey that the agency undertook. We kind of borrowed some of the domains that are contained within this ETOlution milestones. I call it kind of a quick and dirty self-assessment tool at the organizational level. And it's an easy way for organizations beginning an organizational change process to assess where they are and plot where they are on the various domains that are contained in this brief self-assessment tool. Next. So we've been around a long time as an agency. We're a multi-service agency founded in 1900. We're in a suburban county that is contiguous and directly west of Philadelphia. We're a multi-service agency, and in our national system network of agencies, the Alliance for Children and Families, we're considered one of the smaller agencies. So, you know, we're not a $20, $30 million agency. During this change process, our budget kind of floated between $4 and $5 million while we've been working on this, this process. We have a staff of about 60 and 3 discrete office locations. And we have about 20 programs that are kind of grouped in 3 different areas. I'll talk a little more about that, but services, we have a prevention department that provides a number of community-based early intervention or prevention services. We have a number of senior delivering services, and then kind of an array of other clinical and support services in the agency. And we're a member of the Alliance for Children and Families, our trade association headquartered in Milwaukee. Why are we doing this? I wanted to give some, you know, kind of a summary as to why would one embark upon a theory of change process and a journey. And yes, you'll see later, I have a lot about the meetings we had. We did receive extensive consultation with David Hunter. That was grant funded. We spent about 9 days of workshops with various levels of the organization in developing our theory of change process with David Hunter. But this process does let an organization measure its success. You know, the pitch that some agencies, it gets your attention, is if you measure the impact of your work and you can prove you make a difference, it distinguishes you from other people in the community and may attract additional resources and additional attention to the work that you're doing. So that's kind of an important reason to do this kind of work. It may expand your resource base. It allows an organization to focus its resources and achieve the greatest impact, and enables an organization to be more competitive, which I already mentioned. And it strengthens your program planning and your strategic positioning of the organization. And it lets your organization, not its funders, which is always a tension that we have and a balance that we must achieve, it lets you kind of define your own outcomes and not always be externally driven by funding sources. So how do we prepare for this? What are the reasons for doing this? Where are we in the process, and what challenges are we facing? And when will this transformation be completed? I can already tell you the answer to that: never. It won't ever be done. We're about 3 years in this process. And I know for those of you who were in the workshop that Congresso just gave, they say this is a 3 to 6 year process. That's if you're well resourced. My agency has had some resource challenges. It's going to take us longer than that. Because we have had some resource challenges with the recession in recent years. Next. And to date, what have we accomplished? I know this is a very text-heavy slide, but I wanted to kind of start up with a summary. We adopted a new mission. We identified our target population versus our service population. Again, you know, this is the agency's effort to focus, focus, focus. It's what David Hunter was talking about in the general session. We grouped all of our programs under 3 new departments. We completely transformed the organizational structure of the agency as a result of the workshops we had with David Hunter. We identified outcomes and indicators for core programs. Not all the 20 programs at Family Service are outcome-producing programs. Those programs that are output-producing programs, we attempt to develop quality indicators in those cases. to help strengthen the quality of that work. We developed a centralized intake function for all our program participants. I'll talk more about that. And conducted agency-wide training on all programs and developed an intra-program referral process in ETO. We trained our staff in the use of ETO, trained 2 ETO Gold certified administrators. One is in our audience, Mia Julson, who actually was our primary ETO administrator during most of this process. We began using ETO to track the effectiveness of our programs, identified a model of case management. We found that we increasingly over the years had staff, because we do lots of educational programs, that basically had education degrees and really didn't have experience or training in case management. So we developed and trained staff on a strength-based case management model. We piloted a supervisory outcome in ETO for performance management and secured grants to fund this process. We've had a number of grant sources, which I'll talk about a little bit later, that help fund this with capacity building grants. So we began our journey really in attempting to organize the work in some logical, reasonable way in 1992. I've been at the agency for 30 years. You know, one of the challenges when you're in a multi-service agency, our quest was always finding some kind of centralized database or software package that we could use that would be useful in the wide array of programs and services that we have in the agency. We spent a long time looking at behavioral health kind of packages, very expensive, just didn't meet the, the job of our agency until we discovered ETO. In 1994, we began replicating our first evidence-based program, which was actually being seeded by the Alliance for Children and Families. It was a school-based program, families and schools together. So we were early adopters in our county of evidence-based or research-based programs. And in 2006 and 2007, we realized also that we needed to strengthen the IT, really kind of structure of the agency and make sure that we had computers for everybody, had interconnectivity of all of our offices. So there was lots of preparation work prior to our actually launching into using the ETO software. Next. So our intense process in this evolutionary journey began really in 2007. As a result of the consultations with David Hunter, we developed and adopted a theory of change. We embraced an agency-wide commitment and implementation strategy to support outcome measurement. We identified program-specific inputs and outcome data and initiated the board's use of data to inform decision-making and strategic planning activities. We had, and I can't emphasize this enough, but you see the first 3-day corporate level consultations we had with David included board members. And the other thing that is notable to me, having attended 3 social solution conferences, is how few of my colleagues are in the conference, executive directors and CEOs of agencies. I mean, that's notable to me. The fact that you don't have the highest level of organizational leadership. At our agency, this is something that was driven by all levels of the organization, including the board of directors. And it's something that as the CEO I championed at the agency and still do. We had a second series of consultations for each of the 3 agency departments. These were drilling down and really looking very carefully at each of the program elements within the 3 new departments that we created. And we did that work with David Hunter as well. And after all that work during those months, we had an all-agency staff retreat, and basically I introduced staff who had not been involved in the prior sessions to the theory of change with a formal presentation. And then we had David Hunter, who came and attended Family Services board meeting on March 28th and told them they needed to raise more money, and more money, that the board was not doing its part in supporting this change process and really needed to do more heavy lifting at our agency. It's something that's still a challenge to the board at our agency. Next. We appointed an ETO administrator, and then David Hunter and Vince Griffith met with key family service staff and developed a timeline for the implementation with a target date of June 16, 2008. Key managers met to develop a universal intake protocol for demographics. There were two challenges in the theory of change that we developed with David Hunter that we still are struggling with at our organization. The Congresso is further advanced in their ability to manage this, and that was, as a multi-service family service agency, we don't have a centralized intake department. It's not staffed. You know, my funding sources don't give me money to do that. We don't have centralized case management staff either. We're not a community mental health center with an intake department and case management staff. And we don't have the resources for that. I have case managers that are program specific, but I don't have centralized case managers. You'll see a little bit later this when you're shifting from a program-centric orientation in your agency to a client-centric approach where you want to integrate all your services and deliver those to a single client, all the services that they deserve and are eligible for. It's very desirable to have a centralized intake department and have centralized case managers managing the care or services that person is receiving. We haven't solved that problem. So what we did in conversations with Vince is created a site, a universal intake site in the agency, and everybody who comes into the agency goes through that centralized intake site. It took a long time for staff to adapt to that and realize they had to intake everybody through the software and then refer to their own programs or to another program in the agency if it was more appropriate for that individual. The ETO administrators met with program staff to complete data collection forms and gather program assessment and reporting requirements. So for all the agency's programs, the challenge was that everything had to be electronic and put into the software. So that kind of began a process in our behavioral health program. Staff looked at all the existing assessment forms and the tools that they already had, and they made some adjustments. They changed some of that, adapted it, modernized it. That was a significant process for all the program staff to go through. I mean, we had some stuff electronically, but not everything. So there was a lot of work, preparatory work, just getting everything available so the social solutions staff could actually build out the software. Next. All agency received, we have staff, I guess like all social service agencies, of varying ages and varying computer capacities and competencies. So, we, with our connections with NPower PA, which anybody who hasn't heard of NPower was created by Bill Gates out on the West Coast. There's a number of NPowers throughout the United States, and they provide IT support to our agency at affordable rates. So we had them come in and provide some general computer training on Word, Excel, etc., to really kind of improve the computer literacy of staff. Still a challenge for some staff. I'll talk toward the end of my presentation around core competencies staff need to have in our organization and how we're trying to clarify that in order to be successful in working in this kind of environment. We had the ETO administrator attended, we attended the conferences, all the national conferences, and it wasn't until September 2008 that Vince created departmental blueprints, which, I guess, maybe you need to make some comments about how we wove in. The blueprints included the basic elements of ETO, how to track things, but also performance management components. So you want to talk a little bit about how you integrated that? Yep.
So as you all heard yesterday with discussion of target population, there's a certain model that I loved seeing go up on the board in a number of presentations. So who's your target population? What are the services you provide? What outcomes are you working towards? How do you measure program quality? There's a certain structure that was built into every program that would allow you at the very least to confirm that you were serving the target population that the program was supposed to serve. And I love that yesterday they really brought that up and said this is of utmost importance. And it really is. It derails many programs that try to throw too wide a net. So in each of these programs there was target population identified, the ability to check that you're serving the right target population, at least the ability to measure the quality of services provided, because not all programs are outcome producing. And then if they were outcome producing, the ability to track those outcomes in a meaningful, well-defined way. So that was built into each of the programs in each of the departments.
Next. So finally, our build-out was completed in early October. We trained staff in December of 2008, and we went live November 2008. Next. I want to talk a little bit about the change in metaphor at the agency, about becoming client-centric program, or client-centric agency, and why that's important in a multi-service agency. I already alluded to that. But we were, and I guess David Hunter's characterization of the agency, an aha kind of experience that I had when he came for the training, is he said, you know, family services has been around a long time. Our programs have changed as needs have changed over the years. And we kind of became a holding company, essentially, with an array of services and programs. All of them, some of them had outcomes or deliverables for grants that were determined by external forces. But none of that was really kind of designed or engineered to drive agency-level outcomes. That's kind of a major difference when you think about, okay, so the challenge is, what are our organizational outcomes that we want to achieve? And isn't it desirable to have programs aligned so that they're actually working to drive those outcomes? So staff have some sense that in their individual program, they're contributing to driving agency-level outcomes. Major change in paradigm. So we had traditionally been program-centric, and I mean, we really had pretty discrete silos in our agency, where staff, you know, they didn't think about necessarily doing intra-agency referrals even to other programs in the agency. It's still a challenge. It's easy for staff to get just drawn into their own target population, their own favorite, you know, if it's elderly clients or if it's early intervention, prevention work, and not to think holistically about who we want to serve and what the agency's goals are that we want to achieve. So moving toward a client-centric approach required a significant change in mindset. I think we're still working on that. And the new mindset emphasizes assessing the broad spectrum of needs presented by any client with an agency-wide programmatic response or referral to community resources. That's a challenge when you're a multi-service agency, to get your staff you know, who really are providing home-delivered meals when, you know, an adult child calls and says, Mom needs home-delivered meals. They might need marital counseling. They might be having trouble with their kids. And we have programs to meet those needs. And it's important that you offer those, but it's a delicate balance. You don't want to, you know, we believe in client self-determination in our agency, but if you don't even let them know about it, they can't really benefit from the spectrum of services that you've worked very hard to put together in your own organization. Next slide. So this is a kind of a chart that explains really the difference between those two approaches. Under program-centric, all programs' outcomes are designed by programs. Program-specific performance standards are established. Clients use service as program staff see fit. It's a program-based enrollment, program-based assessment, and program-based case management. The client-centric approach is all program outcomes are indicators for organizational outcomes. Uniform performance standards exist across programs, something we're still working on. Clients use all programs they need. Central enrollment, central assessment, and central case management. And quite honestly, at this point, I don't see us achieving a centralized case management function in the agency unless some major things change in the funding environment. So we developed with David Hunter these broad level, the highest level strategic goals for our organization, which flow from our theory of change, which I'm going to present a little bit later, to be a high-performing, self-reflecting, continually improving, client-centered organization that delivers quality services, to provide education, guidance, and support to assist people we serve to overcome challenges of daily life and to achieve self-sufficiency, and to foster and maintain strategic collaborations and partnerships to meet the needs of people living in the areas we serve. We're involved in lots of collaboration and partnerships, and we do have most of them built into the ETO software that we manage those relationships. Somewhat of a challenge, those of you who are using the entity function in ETO, there's some special challenges associated with that functionality in the software. So these are our agency-level outcomes for all outcome-producing programs. And these sound rather euphemistic at the high level. When you drill down, they get a little more specific. That our one overarching goal is that people will have improved life prospects, that people will succeed in education. These are the indicators that we track to achieve that, and that people obtain and maintain successful employment. Those of you who are United Way funded, you will see when United Way's developed strategies under education, income, and health, there's a lot of parallels. There are a lot of funders that are moving to these broader kinds of strategies that they want to invest their dollars in. Next. That families will function adaptively. This goal was established mostly for most of our early intervention and prevention programs that include parent education and other family strengthening programs. The families will have low conflict. So obviously we have assessment tools, pre and post tests, and other instruments that are used to try to measure the achievement of these particular outcomes and indicators. And the clients reduce risk to achieving and maintaining self-sufficiency. We are the only HIV/AIDS case management provider in our county, so this goal predominantly, although not exclusively, relates to that program that we provide, is getting people to reduce their risk behaviors and to maintain healthy behaviors. And I'm just going to go a little bit into what is our particular theory of change and talk about how that plays into the charts that you have. But according to our theory of change, family service needs to enhance its organizational resources, manage our management strengths and staff capacities and capabilities in order to maintain high quality of its current programs while making necessary organizational changes that will lead to more effective programming and ultimately to better and more sustainable, transformative, and life-enhancing outcomes for the people we serve. Theory of change is, in my view, a fancy term for a logic model. I've found, when you go out and you talk about we're doing theory of change work, unless people are kind of steeped in this, they don't really know what you're talking about. People may be more familiar with the concept of logic models. I think one of the differences is a theory of change process applies to organizational level processes versus logic models tend to be more program specific in their structure. Next. So this is family services theory of change. I'm not sure I'm going to read through this whole thing, but essentially, if we have well-aligned and tightly managed core programs, if we implement, if we have a well-built organization that can support its departments and programs, if we have a strong, well-aligned, tightly managed array of core programs and a well-built organization, then we will optimize our ability to help our targeted program participants achieve key outcomes. And then this is okay, you want to go one more? There we go. Keep going. I'm just going to go straight to the graphic. So this actually, I don't claim credit for this. David Hunter created this chart. Any of you who may have worked with David Hunter may be aware of this, but it kind of shows the process of how, at the highest level and how you drill down, that you have a strategy, the mission becomes meaningful through the articulation of goals, becomes tangible by setting objectives, are made real by specifying measurable outcomes and impacts to be achieved within the context of a specific domain through a well-codified intervention, are assessed by evaluating indicators, are evaluated by applying measures, are the means for collecting data, are the basis for organizational learning and managing. It's a mouthful. It's a lot of work. I mean, if you embark upon this, it's an elaborate process that is a lot of work. Next. This is where the self-assessment tool, everybody who logs on to ETO, you see this. This is contained also in the ETOlution milestone self-assessment tool. This is where we kind of derive the charts that our work plans that I'm going to talk about a little bit later. I'm going to go to the next one. So this, you should have this as a handout. I'm aware that nobody could really read this on the screen. Where did this come from and why did we develop this? We had been receiving funding support, program level funding support from a hospital conversion foundation. I don't know whether a lot of you have hospital conversion foundations. It's a foundation created when a nonprofit hospital is purchased by a for-profit hospital and they spin off that into a foundation. We have 4 in Montgomery County. One of those foundation directors actually had used David Hunter as a consultant to do strategic planning. And he had been the executive director who is really into system change and an interesting person to deal with. Had suggested to us that we contact David Hunter in conjunction with our purchasing the ETO software. And what I should mention is we purchased the ETO software and began a build-out, which Vince is going to talk about a little bit later, before we began the theory of change process. And we began to build out the software, and it was all organized around where our physical locations or where our offices were. And so we had to, after the theory of change, we had to throw that all out. We're not the only agency that went through this process. I think Congresso built out their software and they went through a theory of change process and had to kind of redo it as well. It would have been a completely different build had we not gone through this theory of change process. So the director of this foundation, said, I want you to come up with an art project. I want you to come up with some kind of way of demonstrating to me what the process is that you're going to go through as an organization so I can talk with my board about it, because we're really shifting from program level funding in our organization, our foundation, to capacity building support. In the 3 years that we've been supported in this work, we've received about $250,000 from this foundation. And because we're perceived as a learning organization, we're in sort of a non-competitive status with this foundation. As long as we meet the expectations of that foundation, we're eligible for funding on a year-to-year basis. So I developed this multi-year, and I've plotted where we are, which shows really kind of incremental movement along this 4-stage journey to becoming a high-performing organization. I thought, for people who are contemplating this process, what was important for me was to actually break this process into discrete, manageable stages if you're going to go through otherwise it's completely overwhelming when you look at all the elements on this. And it's useful if you're talking with outside funders to have some vehicle to demonstrate to them, and you'll see that's where the work plans come in, that you're actually making some progress and you're working on particular domains. So this is kind of the broadest kind of, at the 10,000 foot level, what our estimate is. And the foundation, when I presented this to them when we first started, and we were just at that phase of August of 08 or 09, I did get a reaction when I said that this was going to take until 2014. And that's another dilemma that you have with foundations that are used to giving programmatic support. They want you to develop new pilots and new programs every year. They want you to come up with kind of the latest variation on something. It's a major change in mindset, and it's a lot of work to maintain that relationship with that foundation or that funding source so that you kind of bring them along and have them aware that you are making progress, but it's difficult work, it's organizational level work. There are lots of elements to it, and it's going to take a long time. It's going to take more than 1 or 2 years to accomplish this transformational process. Because I was getting the impression after 3 years of support from this foundation that they were having funder fatigue with our agency. And I should say this foundation has 4 of my colleagues that sit on the board, 4 other execs who are not real happy with all the money that we're getting from this foundation. So we've invited the foundation director and his board and other outside grant reviewers to come for a site visit that we're scheduling sometime in October or November to make a presentation to them, to let them know and to field any of their questions that they have about where we are in this change process. Early on in the grant process with this foundation, I made a presentation to his board as well. So I think it's important, if you're doing this kind of transformational work, to maintain really close working relationships, in this case with an enlightened funder who is really committed to strengthening organizations, believes that organizations should be learning organizations, committed to self-improvement and to high quality and making a difference in the lives of people that they serve. Next. So this is year one work plan, and I mean, God help you if I tried to go through all of this, but yes, it's detailed. What we did, and now it's kind of blurred in my mind, maybe Mia remembers how we generated this, but what we did is looked at the ETOlution milestone domains, and we did some collapsing and kind of picked and choose what domains we thought were the important domains that we were going to emphasize in our transformational work. And we did follow kind of a logic model format for this. When I present this to the board, their eyes glaze over. It's too much detail. It's really important, if you're doing this kind of work, to kind of parse this in a way. If you're working on one domain versus others, more so, it's really probably smart to talk about the specific work that you're involved in. So in year one, what were we working on mainly? We were working in the domain related to data quality and data integrity. We're still working on that. We spent a lot of time on that. That's the garbage in, garbage out issue. We had lots of issues with duplications and duplicates in the intake department because people couldn't figure out how to navigate that. They kept entering the same client in the intake department. And so at one time we had how many duplicates in year one?
I think some people were in the system 685.
But we had maybe a total of what?
Oh,
maybe 800 duplicates. We serve about 15,000 people a year in our various programs. So we had about 800 duplicates that had to be purged out of the system. So you're going to spend a lot of time in the early period of this transformation simply training staff, supporting staff, coaching staff. We probably needed to do more of that on just how to navigate and use the software so you have good data going in and making sure that they actually use the software. So that was kind of the main focus of year one. Year two, we were beginning to make progress in that area, and staff were really beginning to kind of figure out how to navigate the software, but we did a lot of tweaking and perhaps too much. I don't know, Mia, whether you want to talk about that. Some of our assessment and evaluation tools. In our prevention department in particular, we had a family assessment instrument that God knows how many times the staff kept fooling around with that assessment. When you also begin to measure and report to your funders, the other experience that we had is that we have a Safe Schools Healthy Students grant, big federal grant with the local school district, and they have dedicated outside evaluators. Her appetite for data became insatiable. She placed lots of demands on us, and then you have to kind of figure out, once you have data capability, how responsive you're going to be and what your resources are going to be that you're going to devote to providing that information. So you've kind of created a monster where they see, gee, this agency is actually measuring something. And then the other problem is you have funders, and we've had this situation with a truancy abatement initiative that we had with 13 partners, is the funder really wanted much more detailed evaluation data and didn't want to pay for it. We actually had a bid from Social Solutions that, since we had 13 partners, it was a fairly hefty bill that they could have afforded, but they weren't serious enough and really didn't want to pay for it. So you know, that's another kind of thing that you have to kind of navigate with outside funders. And then in year three, the one thing that, as a small agency with 60 employees, we do not have a dedicated human resource department. That functionality in our agency is kind of distributed among a number of managers. Our bookkeeper in the business office deals with benefits and certain other kind of technical issues related to HR. Our director of finance is kind of our de facto HR manager. And when we began to look much more carefully at outcomes related to our programs, then you get into the issue of performance management with your staff. What kind of evaluation systems do you have in place? And we were not happy with the approach that we had used in our agency up to this point in time, what our hiring practices were, our job descriptions, what the orientation process is with staff, and really, do we have the right people in the right jobs, that we need under this system. So we got another grant, and in the last several months, actually beginning in March, we began a process of identifying core competencies at the agency that we think are necessary in order to achieve the strategic vision and direction that we want to achieve as an organization. So we're using a consultant. Is anybody familiar with Lominger, with Lominger's competencies? Nobody? We're using an organization. Lominger is, there's about 4 national outfits that are, that emphasize competencies in HR work. The oldest one is Lominger. It's Lominger. It's a combination of the 2 surnames of the founders of that company. We're using another organization, Management Resource Group, in Portland, Maine, and they have a slightly simpler approach, taxonomy of competencies. What we've done since March is we've identified, with the senior management team, we've identified 8 core competencies. The way we began that is we articulated what our vision and mission was for the agency, what the strategic goals and objectives were, and then we began to pick out of a list of about 20 or so competencies what we considered the core competencies to be that were necessary to achieve success in driving the agency forward. We then began a 360 assessment process where I was assessed by board members, direct reports, did a self-assessment. We looked at the senior management team to see how we aligned with the 8 core competencies in our agency. And we began a dialogue with the board. This is the tricky part of this. Since I've been with the agency for 30 years, this grant actually is leadership development and succession planning. I'm one of those boomers that is part of the 54,000 CEOs that may be transitioning out of their jobs in the next 5 years. So the board is now kind of chewing on, are they in agreement that these are the 8 core competencies as the board of directors for the agency? And we need to make sure they're aligned and in agreement with the senior management team. And are these the same core competencies they want for my replacement when they look to replace me in the future? So we're hoping that once we're done this process, looking at our human resources and how we hire, train, and deploy staff and what their core competencies need to be, that we will also be able to develop better job descriptions and performance evaluation systems and weave this into the ETO software as well. This is the latest stage of where we are in the process. Next. This is up to you now.
All right. Thank you, Mark. A couple things I want to say before we, I'm sure some people are thinking, finally get to ETO. As I'm listening to that, and I'm thinking, if I'm sitting in the audience, I know you're from organizations of all sizes, all resourcing, maturity, leadership, that this is a lot, right? The reason why I really pressed and was so happy that Family Services was able to present this is that they have developed a process and a system, and they've codified what they've done in a way that I think allows you to have a full picture that you can use to find where you are within that. So I mentioned a couple things just kind of diving in. One is don't be discouraged or frustrated or think that's just a lot of stuff, and it is. And Mark's leadership made that happen. As Mark mentioned, he's been involved. That's essential. So you can start simply, and I want to put out there that what anybody can do is really start to look at your data quality and data integrity. It is so central to being able to use your ETO for anything, right? External reporting to performance management internally. Is this information complete? Does it make sense? That's the first step. I'd also mention focus and simplicity. I'll keep coming back to simplicity, and we'll see how that played out in what started as a very complex site-based system, so physical sites with lots of stuff, into some core principles based on the theory of change. So this whole idea of target population, of well-defined small set of outcomes, things like that. So you'll see some of that. What I want to make sure you walk away with, and I'm very deliverable based at being a project manager. So something like this and the plans is like gold, right? It's like, wow, someone spelled this out and they can say what they got done within this process. The other thing is when you walk out of here, deliverables are, you will have a picture of an organization that's on the path to something that is, in my mind, very special and unique. It's along the lines of Congresso, of LAYC. Family Services is one of those organizations to be seen in that light. But I also want you to walk away with, okay, what does that mean for me practically? Because that's important, right? This is not just about telling a good story, although that's great. It's about how does this apply to me? So what I want to show you is how all this stuff applied to them in ETO, and hopefully you'll start to see some things that you can do with Social Solutions help or on your own. Both are possible. So what we did with Family Services is the first thing, and this is just part of the story that really is big picture, is that Family Services reorganized their organization to fit into their theory of change, to be able to manage performance. You all may have organizations that, I know I worked at one before we started the business, where there were a lot of programs and they were all over the map. And it's very hard to manage as say a department head when you have pieces that don't fit together. So what Family Services did is that they put together 3 divisions with programs, in some cases, that moved from this person over here to this person over here because it made more sense within self-sufficiency and financial management. So we mimicked that reorganization in ETO. So we'll see how a screenshot of what we did there. We also configured ETO to measure program quality at the very least, target population, program quality. I neglected to note target population up there, which is an omission that, as you've heard, is very important yesterday and today. And then to measure outcomes where appropriate. So we'll look at how we did that. And then this is absolutely central, right? I'm sure all of you know, is that configure ETO to be as simple as possible. The great struggle, right, of external reporting needs and simplicity, user experience versus reporting, the balance that you must strive towards at all times. So we'll take a look at how we did that too. Thanks, Shushma. So the first thing is I took this screenshot out of ETO because it shows the old programs as in red, disabled, the old sites, I mean, and then the new ones. And it shows this is central in your ETO, is not only if you have multiple sites, which some of you do, but just even within your program structure, that you're really thinking about what's a program or what's a site. Is it a physical location? Is it a domain area? These are kind of big picture, but very important because they drive performance management. These are, in a sense, silos, right? So when you operate within them, You should think of, is it easy to navigate within it? Is it easy to report out of it? So you'll see there a move from physical location, which Mark doesn't mention as part of this journey. I started the implementation, and as we're going through the implementation, and I didn't know David well at the time, but I knew of him. And they said, well, David Hunter's coming. And I said, well, we could just stop right now because whatever we're doing is going to be turned on its head and we're going to redo it. So we in fact did, which I think is a wise resource decision. Let's stop and wait for the proper business intelligence to come in so we can create this. So this is kind of a big first step. Right? It allows for performance management where it didn't before. It was very hard within a physical site structure to manage performance. So that's something to think about. Thanks, Shushma. The other thing we did, and this is, I would say, think about this within your organization. That another challenge is if you have multiple entry points into your organization in ETO, can you manage your program in a way that you are doing what Mark has talked about today, identifying needs in a consistent way, a client-focused system. This is a kind of driving towards a client-focused system. A client walks in, you assess them, ideally with some type of centralized assessment tool, if that's possible. It's not possible in all agencies. And then from there, you identify not only what the person came in for, but potentially things that they did not identify, but which are essential to their success. And so it's a virtual intake program. In the case of family services, they're not resourced to have an intake. They have multiple physical locations. But within ETO, you change that world. It is an adjustment. And I have had implementations where customers have said, we can't do that. And I certainly respected that. It's just not, it doesn't fit within their model. But it's something really to think about. So structurally, this was really focused on their reorganization and their ability to manage performance. Thanks, Shushma. So here's where you start to get into the area of the ability to measure outcomes. So as you probably know from those that you implemented with, from our support team, from others at Social Solutions you've talked with, or maybe some of your peers, you can measure outcomes a number of different ways in Social Solutions. So one thing that I found to be very effective is, and this is what Family Services did a lot of, is if you look at this slide, and my eyes are not good enough to actually see it from here, so I'm going to just tell you what this slide represents is multiple baseline and follow-up assessments. And so what it's looking at is what did a person look like when they came in? What did a person look like at points thereafter that are defined? So 3 months thereafter, 6 months thereafter. Isaac yesterday noted one of my favorites that they actually did apply here, which is a retrospective post-survey. So the ability to capture information at the end of a person's experience in a way that reflects back on their what they felt when they came in. So there are different ways to do that, but Family Services went from a lot of forms collecting information, which they still have, intake forms, information forms, to assessment instruments that were both validated and in some cases created based on their experience. And I think you heard yesterday David say that if it's well defined, it can be created, and if people understand that instrument, there is at least performance management value in it. Perhaps not evaluation level, high level, but so that's a big thing that happened within the system is wherever possible, if this is an outcome producing program, are you capturing those outcomes in assessments, or if we look at the other example, thanks Shushma, within a point of service element. So Scales were developed, definitions applied to those scales. That information was captured in something like an ETO report. You can see, and I'm going to just come over here to note that in improving family strength with these values of family strength defined in the software, understood by staff, within a period of time, how much service was provided and how much change occurred within each of these. So how many people, numbers and percentages, moved to a stronger family based on the work that was provided. This is sort of a pure ETO effort to outcome. I would say that and simplicity and limiting the number of these is essential. It's always a stressor that, well, my funder wants me to capture these things, and we believe we do these 10 things. And something that we heard years ago and we've really pushed on is that you really should limit what you're focused on. Think about just your daily lives, that your ability to manage tasks and achieve outcomes in your own life can be limited the more you add to it. So we would generally say 3 to 5 outcomes in a program, and really as much as possible pushing toward the former. Now, of course, there are all kinds of programs, there's all kinds of resourcing around programs, but really the key there is focus, right? So as they're moving through their plan, their staff is moving from the all-important data quality, which Mia and Shushma could speak to, the time that they spent. The funder said, a year for data quality? Is that all you're doing? But it is everything. and it's changing the behavior of your staff. So the final thing I want to talk about, just and then I'm going to hand it back to Mark, is that in getting the most out of ETO, our system is, when we went into business with a flexible product. It is configured a certain way. We empower the customer to continue to configure it to meet needs as they arise. The assumption is, family services is a real example of a dramatic change that was reconfigured. You have the ability within your software to make decisions about how it's configured at any time. I would say that this is an example of configuring on a well-informed base. So the foundation is solid, a theory of change. But I think I want you to leave with the understanding that because not all people understand this fully, that your software can do these things. It can go from something very complicated to something more simple. We understand the balances of, you need to report externally on certain things, but on an internal level you want to limit what you're measuring so that you can actually manage that performance. And I would encourage you to utilize resources at Social Solutions. I think with people that have implemented, we don't often, sometimes we miss opportunities to help people evolve in their use of the software. So again, I'm going to move it back to Mark's very detailed and multi-year example, but keep that in your heads that your simpler evolution perhaps is also possible. So Mark?
Thanks.
Yep.
So what did we learn in this 3-year process? Well, the one thing is, don't begin this when a recession. We didn't know a recession was coming, but it wasn't a good thing. Communicate, communicate, communicate. We probably under-communicated. It's easy to get stuck in the detail of the work. With emails, we've developed cheat sheets for people that really got stuck in certain procedures. Have sufficient meetings. Part of what we struggle with, and we're still having issues with this, is because we switched to 3 new departments, we're still figuring the meeting thing out. Like, what are the right meetings? Who's at the right meetings? Are we communicating effectively? We're still working on that issue. Training. It took a lot more training. I mean, we have had conversations, how many more times am I going to train that same staff person, you know, on the same thing? Is this now, you know, a supervisory issue, and should they be in the job? You do have those conversations about people. Everybody may not survive through this process. Early in the implementation process, you're going to spend a lot more time on data quality than you know. Obviously, if you're a single service organization, small, it's not as complicated. I'm talking about in a multi-service agency. And then after the implementation phase, Vince went away. We felt like we were abandoned children. This was really bad. We brought Vince back. We've had regular go-to-meeting sessions with Vince, probably initially a couple times a month, and then maybe monthly, and then maybe once every 6 weeks, to deal with the dilemma we ran into. Is it's fine to use customer service around specific issues. If we had system-wide kinds of questions, we needed to talk to Vince about that, because he helped us design the entire system that we had in place if we were encountering that kind of level of problem. So we continued to get support from Vince along the way. Originally, if you planned or allocated resources for your ETO administrative staff, you'll probably want more. You know, the board asked me how many more ETO administrators I need. I said probably another full-time position. The other delightful experience we had is Mia went out on 2 maternity leaves during this process and then left us. So, you know, the lesson I learned in that is that make sure you don't rely too heavily, which I think we did, on your ETO administrators. Make sure you bring along your supervisory staff, and gradually and progressively, and you really have to hold to this, improve their competency and effectiveness in using the software. That's something we did not do a good enough job on. Identify key staff. Finally, in departments, we've identified key point people who we think are the strongest staff within departments or programs. Because now Shushma is our only ETO administrator, she also runs a program for us. So we want to have some other go-to people for simple kinds of usability kinds of issues in the software. So we've identified and had some training for selected individuals within those 3 departments and in our offices throughout the agency. And use a buddy system if necessary. We've had that sort of informally. That can be a tricky process, but you know, if you don't like that, try the point person approach. And the creating reports took much longer. So one of the challenges you have when you're stuck in the data quality and you have people inputting data is that unless you can get meaningful information out of it to inform decision making, and so staff know that they're achieving outcomes, you have to have reports. And you know, we have a lot of programs, and that was a lot of reports with limited staff. So, and I guess, you know, Shushma can speak to this, but we did purchase ETO Results, which has significantly improved our ability to create those reports. We're still doing that. You know, I don't think we're where we want to be at this point, but we are still developing those reports. And then obviously you need to train your supervisors on how to use them to get the information out of the software to be meaningful. The grant sources I mentioned, all of these grant sources were capacity building grants. So we had the purchase of the software was a combination grant from a local community foundation and a large national foundation, Pew Charitable Trust. And then our ongoing capacity building grant from the local hospital conversion foundation. We have gotten 2 capacity building grants from the Pew Charitable Trust. The leadership development and succession planning grant we have is a capacity building grant from Pew Charitable Trust as well. And then our National Trade Association, the Alliance for Children and Families, has a large Kresge Foundation grant that is emphasizing the use of strategy in nonprofits, and we're applying for a transformational grant support there. That's something that's pending. But there is money out there to support this process. I know all of us live in different kinds of environments. These are foundation grants. I know some of you, I'm in a foundation-rich area, the greater Philadelphia area. Some of you don't really have that kind of rich resource base, but you may want to try looking at some national foundations as well. The obstacles and challenges, money, obviously. I think we'd probably be at a further point if we had more ETO administrative staff to drive this. And I think we needed to spend more time on staff training. And it would have been great if ETO results was available sooner, but it wasn't. But that is something, if you haven't purchased ETO results, it's something that you should think about. And the other issue that's a constant dialogue and discussion that I think there was a discussion about this in the open forum, that not only should we rely upon foundation directors to talk to their peers about the need to support this kind of work and to make longer-term investments, we need to stand up and do that as well and really advocate for that. I mean, the challenge for me is about 78% of our agency's budget are governmental grants. The challenge is when I talk to my HIV funder, which is the Philadelphia Health Department that funds 9 counties in the Philadelphia region, they just complain about the Health Resources Services Administration, so we can't do anything about it. But you need to have discussions with them if the systems don't make sense, or if they're not really investing sufficiently in your infrastructure costs in order to deliver the outcomes that they want. We need to complain, constantly complain about it, and make a big deal issue about it. We're just not getting enough money to support what the funders are demanding at this time, and we still have these ridiculous restrictions on overhead. It's just crazy. And the staffing and skill development, I mean, this does take staff to develop new skills, not just computer competency, but new skills. And so you're going to have to invest more resources and time in that. And striving to be a self-reflecting, this is David Hunter language, learning organization and creating a normative culture that emphasizes performance management and high-quality services. If you're not there already, that's a lot of work. That's a big deal in your organization, having people have that kind of attitude and stance in your organization about their work. And currently, I already mentioned this, currently this is a little more detail about the work we're doing on leadership development and succession planning. But you do have to change, and I think this was mentioned in Congresso's workshop, we need to really change all of our job descriptions. We need to weave in use of ETO and performance management in the software. It needs to be kind of part of the organic structure of the agency, and we need to include ways of hiring staff and assessing for readiness for that more so in a more effective way. That's something we hope to achieve with the work we're doing on core competency and conducting a competency-based interviewing process when we hire people at the agency. I think that's it. Any questions? We talked a lot at you. We have them numb. Yes?
What process did you use to simplify the data set that you wanted to examine?
I'm not sure. It's a very general question. Not sure I know.
Was there discussion? Or did you some specific collaborative procedure?
So the question, just so we can pick it up, is what process did we use to simplify the data management procedure?
Yeah, you have emphasized keeping it simple. What did you use to keep it simple?
Okay, so the starting point is utilizing the discovery materials that we brought into the equation. So any implementations that are done or were done back then, people complete a program chart. So the program chart is very detailed and increasingly example driven. So it says, in this program, it asks some general information about the program, but then it gets very deep into defining very clearly a target population, a service population if there is one, the outcomes that are to be achieved, the services that are delivered, the way program quality is measured, and I would consider that the raw material. So when that comes back, the process that happens is then we begin to dig in around it and have a discussion with the program manager, and in some cases the staff, certainly, and then of course leadership around, are these truly the outcomes of the program? We start to whittle it down to what is achievable, and to get to perhaps your question around the way that decision is made. As a company, we've become much better through things like the relationships with public-private ventures or child trends around, in this type of program, what does the research show about the ability to achieve outcomes, the dosage that's required? So where we have that information, we then apply it and say, is it reasonable to assume that with a drop-in type program that you can achieve these outcomes, because you can't require that there's a monthly 1-hour interaction with the individual that's focused on these particular things. So that's the process. It was a very iterative process that started with certain basic discovery materials and worked its way down to something that we collectively felt was the best description of the program and something that the staff could use. And then I want to add one more thing real quick, that also met external reporting requirements, because we know that has to happen or the program doesn't move. Is that okay? Thanks. Thank you for the question.
Yes.
I was looking at your slide where you were doing reconfiguration and you reduced your services or programs down to 3 divisions you had talked about.
Correct.
Did you experience any sort of impact from program managers in that process? And but I can see in the next slide below that you made them more client-centric, so you centralized things, and you were able to, rather than focus on each particular program, you look for the commonalities in them. Can you talk about that?
Yeah, I mean, it's funny, when David Hunter came and first said, well, how did you organize your agency? We said, well, we provide service to children, seniors, and families. He said, is that how your organization is structured? We said, no, that's for marketing purposes. And so he said, well, what would be the normal kind of structure you would have? Well, we have a big prevention department with an array of services. So that became the early intervention, prevention and education department. And it was a natural grouping. I mean, we looked at what were natural grouping of various programs that really did have, in some cases, synergies between them. They may have had clients that went from one program to the next. So that we kind of looked at programs within the agency that had either a similar target population or a similar outcome they were trying to drive. So that's how the departments were organized. So we had the department we're wanting to expand. We had a car loan program, and we participate in the Volunteer Income Tax Assistance Program. So we created an Asset Development Self-Sufficiency Department, which is actually an emerging department in the agency. And that made sense for those two programs. And then the problem we had is we have a Clinical and Support Services Department, which is more of, it's kind of like a mongrel department. We have our behavioral health program, our HIV/AIDS case management program in that department. That was not as natural a grouping. That was more of a force kind of. But we did not get a lot of pushback. I think it made sense to the staff that they would meet in a way where they had more similar kinds of functions, rather than having, you know, office-based meetings with a mixture of programs where they didn't really necessarily share the same issues they were dealing with. So this kind of made sense. I think the danger is it created 3 new silos. And so, you know, that's the issue you always have to deal with around communications. Any other questions?
Yeah.
Yes, sir.
You mentioned that your experience with ETO is driving you to go to your job descriptions.
Yes.
And that's driving some changes in your job descriptions. What are there key points that you've been driven to consider staffing, either end users or managers or supervisors? What are you needing to do to change? What are you changing in the job description?
We haven't gotten there yet. We haven't gotten there yet. I'd love to be able to answer that question. So we just began identifying the core competencies. We have not gotten there. It's like a year. We just began that in March.
But
So
that is
it's an important question. I understand.
Yeah, and that idea of the core competencies does ultimately get to your question of what are those core competencies.
Yep.
As a last little point about that, Mark and I have had the discussion, and it's become increasingly obvious to me that all of this that we're talking about at this conference is ultimately ends up in HR. And I mean that in the broadest sense, that your people drive this, and their ability to do that is central. Just like anything, right? A person delivering counseling needs to have that training and that background to be able to do that. So, where Mark is in the process is of great interest to me in terms of how is he doing that.
Well, are you as a company looking at these competencies?
Oh, we certainly will. Yeah, we've talked about with Mark ahead of time about is that something? How does that connect with ETO? And it's an ongoing conversation. It's not that it's necessarily part of the software, although it may be, but ultimately that's what the software is about. When we were youth workers, we wanted to become better at our work, and so it's really comes back around to, the things that enable you to actually use the software, not only put data into it and report on it, but then use the information to be better at what you do. So there's a loop there that's of deep interest because it's what we founded our company on. But we don't really know what that means yet. So we'll let you know.
Yes, sir.
Mark, you mentioned that you were going to show the list of core competencies to your board.
Yeah, they're actually, the executive committee, they've already seen it. We want to make sure they buy into it, and there's an alignment and congruence between what the senior management team thinks the core competencies are to lead the agency and making sure our board of directors agrees with that. And they may decide there's particular competencies for the CEO that are different from the senior management team. We're drilling down now. Actually, Shushma is we're at the mid-management level where we're identifying core competencies, and the list may be shorter. So that it's not necessarily universal for all levels of the organization, but they're probably going to be a set core group. So it's still a work in progress. We haven't finished that. But I want to make sure that the board has bought into this process and that there isn't kind of dissonance between the senior management view of what it takes to run the agency and that the board has bought into that. Well, thanks, folks.
All right, thank you very much.
Thank you very much.
Enjoy lunch.